As the buses full of people forced from their homes left parts of Eastern Ghouta, after 5 years of siege and bombings, government forces and allied militia moved in. Pro-Assad government TV crews rushed to show how the enclave was run by rebel fighters, who they called terrorists. The relentless bombardment forced people underground into basements such as this one in Jobber. Frequent attacks on hospitals meant even treatment was being provided below ground level. The narration says only fighters were allowed in and civilians were prohibited. Charities supporting health institutions like this deny those claims. According to Syrian media, every organization helping the besieged population of almost 400,000 people was supporting terrorists. But doctors say their oath demands that they treat people who need medical assistance irrespective of political or ideological affiliations. The government says there was no medicine shortage in besieged Ghouta. Medics say the boxes of medical supplies brandished in regime propaganda are misleading.
The situation in Ghouta was extremely dramatic. The needs were absolutely unique. It was an unseen situation. The medical colleagues that we were supporting in Ghouta, they were clearly sharing with us the concern of not having enough medical supplies.
The influx of tens of thousands to Idlib and Aleppo is making things difficult for an already stretched health infrastructure. Doctors at one hospital in Khalat al-Madiq say 5,000 people were dropped off on the first day of the evacuation. Most of the injured were hit by bombings and some had gunshot wounds to be treated in the hospital's only operation theatre. In addition to the hundreds of cases with trauma and injuries, they had to deal with pregnant women giving birth and cases of malnutrition.
It is dire, it is definitely acute, and once the arrival of the displaced becomes more of a stable situation, still the health system existing in the northwest, or concretely in the Idlib governorate, is not enough. You don't have a specialist, you don't have in every health facility enough medical supplies.
Back in Ghouta, medical workers are calling on UN agencies to use the proximity to the capital Damascus to rebuild and support the devastated health infrastructure. Now that the bombs are not falling, there's no more media attention on the health needs. Citing previous examples of neglect in Aleppo and Homs, aid workers are warning of a looming health crisis for the tens of thousands of people left behind in Eastern Ghouta, where the whole population is viewed with suspicion of supporting the opposition. Osama bin Javaid, Al Jazeera, near the Turkey-Syria border.